Well, good evening, everyone, and thank you all for joining me on this second webinar in the Feline Medicine series. I hope you're all having a good evening and you're ready to spend a little bit of time learning about feline chronic kidney disease this evening. So we have a lot to cover in this topic. We're going to be talking about some current concepts, best available evidence for diagnosis and management of chronic kidney disease in cats, and we'll get right to it because we have quite a bit of information to get through this evening. But I do want to thank our sponsor for this evening's webinar, MSD, for joining us and supporting us this evening. So thank you very much to MSD for their support. So what we're going to go excuse me, through this evening is a little bit on how we make the diagnosis of chronic kidney disease in cats and some of the newer tools that we have available to us. We're also going to spend some time talking about the iris staging system and why that's important. And that will lead us into talking about what are our treatment options and what is the best evidence for our treatment options. And finally, at the end, what would we recommend for ongoing or long-term monitoring in these patients? So that's what I hope we'll be able to cover for us this evening. I do want to recommend this fairly new set of guidelines on the diagnosis and management of feline chronic kidney disease from the International Society of Feline Medicine. Even if you're not a member, it's available to you for free. It was published in the Journal of Feline Medicine and Surgery in May of 2016, and you can download it from the journal website using the web address that you can see on the slide. So when you go to that web page, scroll down to the bottom and you'll see a link that says free guideline articles. Click on that link and it will take you to a page with all of the available guidelines, including this one, again, that's available to you for free. So I would recommend that after this session is over, when you have a chance that you go and download that. I think it's only available in English at this time, but please be sure to have a look for this really great resource. So I did want to talk a little bit about the importance of chronic kidney disease in cats, just to kind of set the stage for us on understanding why we need to talk about this. So on your screen you can see a study that was published just a couple of years ago, and it was looking at the reasons why cats die. And these are cats going into regular veterinary practices in England. And so the table that I've put on this slide for you looks at the top 20 causes of death for cats in this study, and these are cats of all ages. And you can see that the number 2 cause in that table says renal disorder. So as it turns out, if we look at the data for these cats, and there's over 4,000 cats in this database, for overall cause of mortality, no matter what age of cat, kidney disease of some kind was the number 2 cause of mortality. And for cats that were over 5 years of age, renal disease was listed as either the first or the second cause of mortality in those cats. So of course, as cats get older, we see a higher prevalence of chronic kidney disease, and therefore we see more deaths as cats get older. So just to illustrate to you, of course, why this is such an important clinical problem. So the ways that we make a diagnosis of chronic kidney disease haven't really changed over the years. We're going to walk through this a little bit and then talk about some newer tools. We still make a diagnosis based on renal azotemia, and that's based on serum creatinine. Creatinine is a more reliable marker than urea. Urea is more easily affected by other factors. So that's why we base it on serum creatinine levels, and we'll talk a little bit more about that. Typically, cats also have a dilute urine, although they may not always in the early stages of chronic kidney disease. Sometimes that doesn't appear until the disease is a little more advanced. But typically, we're looking for a urine-specific gravity that's less than 1.035. And especially as cats progress, we're looking for compatible findings in the medical history, like polyuria or polydipsia, and then physical exam findings such as weight loss, maybe small kidneys, for example, things like that. So the way we make the diagnosis really hasn't changed over the years. Interestingly enough, many cats nowadays are diagnosed with chronic kidney disease, not because somebody suspected they had chronic kidney disease, but because they were undergoing some routine health screening. So on the screen, you can see two journal articles looking at what happens if we do some routine health screening, so blood and urine testing, on cats that are middle-aged or older and that are apparently healthy. So these are typically cats that are coming into veterinary practices for an annual preventive care exam or vaccinations or grooming or something like that. They're not coming in because the owner thinks they're sick. And what they found is that about 1 in 5 cats have a clinically significant finding if you do routine health screening. And one of the most common clinically significant findings in these apparently healthy cats was chronic kidney disease. So increasingly, because it's less expensive nowadays and more readily available to do blood tests, many cats are diagnosed earlier in the course of disease than they were in the past. And that's, of course, a good thing. I also want to share with you this study. We're going to talk about some other findings in this study in a few minutes. This is a study that was a survey of cat owners in the UK. These were owners of cats with chronic kidney disease. And about 11% of those cat owners said that they didn't know their cat had chronic kidney disease, and it was only detected when their veterinarian ran some routine screening blood work in what was an apparently healthy middle-aged or older cat. So there definitely is some value to being proactive and doing some early screening for disease in middle-aged and older cats. So you might, for example, target cats that are 7 years of age, 7 or 8 years of age and older. They would be a good age group to target for regular health screening with a serum chemistry panel, complete blood count, and a urinalysis, looking for diseases like chronic kidney disease. And even if the test results come back normal, that's good news, of course, but we can also monitor trends over time. So, for example, if we see serum creatinine increasing over time, even within the normal reference range, then that's going to make us suspicious that we have a patient that's developing chronic kidney disease. And the same would be true of monitoring urine-specific gravity. As that decreases over time, it would make us suspicious that our patient is developing chronic kidney disease. So there's definitely some benefit to monitoring test results even when they're within the normal reference range. Another way to have some early detection of many diseases, including chronic kidney disease, is to be very proactive in monitoring the weight of your patients. So this is a study that was published just last year looking at trends in weight loss over time in cats that were diagnosed with chronic kidney disease. And they found that in the year before a patient was finally diagnosed with chronic kidney disease, they'd lost a median of 9% of their body weight. And that's a pretty significant amount of weight loss. But for cats where they had long-term medical records and they were able to look back even farther in the medical records, they discovered that weight loss began as early as 3 years before the diagnosis was finally made. So in middle-aged or older cats, unexplained or unintended weight loss should always be evaluated because it's often the first sign, the earliest sign that some chronic disease is developing. That could be chronic kidney disease, could be gastrointestinal disease, or of course there's a lot of other diseases that it could be, but it certainly should be investigated. The other thing they noticed in this study was that cats that weighed under 4.2 kilos at the time they were diagnosed with chronic kidney disease had shorter survival times than cats that weighed more than 4.2 kilos. So that tells us that if chronic kidney disease isn't diagnosed until a cat has already lost a lot of weight, so we don't intervene until later in the course of disease, of course we have less ability to stabilize a cat and less ability to extend their lifespan. So another reason why early diagnosis of disease is really important. Well, one of the newest ways we have for early detection of disease is a blood test that's only been on the market for the last year or two called SDMA. And SDMA stands for symmetric dimethylarginine. This is something that is created by protein metabolism and cleared through the kidneys. It's excreted through the kidneys. So blood levels of SDMA correlate very nicely with glomerular filtration rate. And that's actually why we look at serum creatinine. It's giving us an indirect estimate of glomerular filtration rate in our patients. But it turns out that SDMA is an even better estimate of glomerular filtration rate than creatinine. So it will detect chronic kidney disease much earlier than we are used to seeing if we only look at serum creatinine. So we know, of course, that serum creatinine doesn't rise above the reference range until cats have lost at least 2/3 of their renal function. So in reality, serum creatinine gives us quite late diagnosis of chronic kidney disease. And we need tools like monitoring trends in creatinine, monitoring for weight loss, and now SDMA to give us that much earlier diagnosis. The other reason that we like to look at SDMA is that it's not influenced by muscle wasting. So it doesn't come from muscle the way serum creatinine does. So as we see muscle loss, often just due to aging in older cats, that can affect serum creatinine levels independent of whether a cat has chronic kidney disease. But SDMA isn't influenced by muscle mass. So especially for cats, that gives us an even better estimate of renal function than creatinine does. So it doesn't replace serum creatinine, but it is an additional tool that gives us earlier detection of disease and the ability to start monitoring earlier and intervening earlier when we find treatment targets. And we're going to talk about what those treatment targets are. So we're going to start talking about iris staging of chronic kidney disease. But before we do that, I'm going to see if I can send a poll into the room here and have you answer. Of course, there's not going to be any right or wrong answers to all of my poll questions. They're just asking you what your opinion is or what you do. So none of these questions have a right or a wrong answer. So I'm just interested to see how many of you currently are using this iris staging system within your practice. And we'll talk in a few minutes about why we want to do that and what the benefits are of doing that. So most of you have voted now. I think I'll just wait another moment for any remaining people to vote. And it looks like it's about even between those of you who are using the iris staging system. So about 50% of you said you are using the iris staging system, and about 50% of you said you're not. So that's actually good. So it'll give us an opportunity to maybe introduce the concept to those of you who are not using the iris staging system. Well, one of the resources, of course, I recommend you look at is the website for the International Renal Interest Society at iris-kidney.com. That's where you'll find everything you need to know about the iris staging system, including free downloads of the charts and the algorithms that can help you stage your patients and then also determine what the best therapies are for your patients. So why do we care about doing iris staging in our patients? Well, there are, I think, at least three good reasons why we should all be thinking about doing iris staging. And I want to remind you that the iris system isn't a diagnosis system. It's what you do after you make the diagnosis of chronic kidney disease to help you with monitoring and then determining the most appropriate treatment. So it's not a diagnostic system, but it's a staging system to help you determine the most appropriate treatment. There also is some data in the veterinary literature about longevity based on iris stage of kidney disease. So it can help us answer questions that owners often have about how long their cat's going to live once they get the diagnosis of chronic kidney disease. And it makes it easier for you and I to talk to each other. So in the past, we used medical terms that really were not well defined, like renal insufficiency or renal failure. But now, if we use the iris staging system and you want to talk to me about a patient that is iris stage 2, I have a pretty good idea of what you mean. So it gives us consistent terminology in our medical records, in our research projects, in our veterinary journal articles, and so on. And that's always a good thing. So the primary way that we do staging with the iris system is based on serum creatinine. So the same thing that we use to make the diagnosis in the first place, serum creatinine, is also the primary way that we stage patients. And of course, we're going to look at serum creatinine only in the hydrated patient. We don't want to look at the effect of dehydration. That's the pre-renal part of increases in creatinine or azotemia. We don't want to take that into account. So if your patient is dehydrated, then you would want to take whatever measures you need to correct that dehydration, and then we would like to reevaluate serum creatinine afterward to accurately stage our patient. And ideally, we'd like to have a couple of serum creatinine measurements just because there's fluctuation from day to day so that we're sure about what stage a patient is in. And typically, we're evaluating these patients over a long period of time, so we have an opportunity to refine our staging. And then the two other parameters that we look at for staging are blood pressure assessment and urine protein. And so we'll be talking about both of those separately as well. So when you go to the IRIS website, you will see this chart that gives you the stages of kidney disease from stage 1, where a patient may have early chronic kidney disease, but may still have serum creatinine measurements that are actually within your lab's normal reference range. So remember that serum creatinine doesn't increase until a cat has lost at least 2/3 of its kidney function. So cats with early chronic kidney disease will have normal serum creatinine. But of course, it's likely to be at the upper end of the normal reference range. So those are the stage 1 cats, and even the early part of stage 2 cats may fall within your lab's reference range. So it's important to remember that just because the lab's reference range says serum creatinine is normal doesn't mean your patient cannot have chronic kidney disease. And of course, stage 3 represents progression to moderate azotemia, moderate disease, and stage 4 would be our most severe patients. And again, we always want to look at that in the hydrated patient. We don't want to be looking at the effects of dehydration on serum creatinine. Well, one of the ways that SDMA has improved our ability to stage is in cats with muscle wasting, as I already mentioned. So because serum creatinine can be affected by muscle loss, if we have a patient that is in IRIS stage 2 according to serum creatinine, but the SDMA is increased greater than 25, we would actually then move that cat into IRIS stage 3. And similarly, if we have a patient in IRIS stage 3 based on serum creatinine, but the cat has muscle wasting and the SDMA is over 45, then we would actually move that cat into IRIS stage 4. So it will give us a better estimate of where the cat stands if we look at SDMA in the muscle-wasted cats and adjust their stage of disease. So I would recommend that you have a look at this free article that you can download from the journal that's called Today's Veterinary Practice. It's available for a free registration. And just earlier this year, in the January-February issue of this journal, it's a very nice article on the treatment guidelines for chronic kidney disease based on the IRIS staging system. So that's another resource that I would recommend you have a look at to get a little better idea of how the IRIS staging system can guide your treatment recommendations. So we're going to start talking indeed about those treatment recommendations. We're going to start talking about what are the best evidence-based guidelines that we can look at for treatment of chronic kidney disease in cats. So there are actually a number of treatment targets that we have drugs or other treatments for, and I divide these treatment targets up into two groups. So the first group I think are a priority. So these three things: increased serum phosphorus, increased blood pressure, and proteinuria are the three top targets that I think we should be monitoring and treating because they actually may have an impact on slowing disease progression and prolonging survival in cats. We have some nice data in the literature that suggests we actually can slow down disease progression if we prioritize those targets. And then there's a second group of treatment targets that might not necessarily have direct data that they slow disease progression or they prolong survival, but they certainly have an impact on the cat's quality of life. And that helps improve the human-animal bond because owners don't like to see their cats sick and lethargic and not eating well. So we're also going to talk about treatment targets like hypokalemia. We won't really have time to talk about anemia today, but that's also worth monitoring and intervening. We'll talk a little bit about dehydration, and we'll also talk about treating poor appetite and treating nausea in these patients. So we'll start first by talking about the hydration, the nutrition, the electrolytes, those things, because they all kind of go together as we're talking about them in terms of treatment targets. So there's lots of reasons why we want to maintain good hydration in our chronic kidney disease patients. And of course, we all just feel better if we're well hydrated, but there are some other really important physiologic benefits. So for example, it helps maintain normal acid-base balance. And cats with chronic kidney disease can have a tendency to develop metabolic acidosis. And one of the ways that we can help either prevent that or treat it is by maintaining good hydration. And of course, being well hydrated improves blood flow to organs and tissue perfusion. And for the kidneys, that means a better or hopefully a more normal glomerular filtration rate. So there are some very specific reasons why we want to maintain good hydration to help improve renal function in these patients. And so we really need to talk about hydration in two categories. One, of course, is your unstable patient that is dehydrated enough that the patient should be hospitalized and put on intravenous fluid therapy. So these are the patients who are moderate to severely dehydrated, maybe quite unstable. They may have electrolyte imbalances or they may have acid-base disturbances, and they will benefit from intravenous fluid therapy in your hospital. Typically, we would aim to replace any fluid deficit over 24 to 48 hours, along with maintenance fluid therapy, and then taper the fluids over the next anywhere from 1 to 3 days, depending on how severely dehydrated the patient was, before we go ahead and send them home. So you do have to estimate the fluid deficit, and we can use our estimate of our percentage of dehydration to estimate what the fluid deficit is. And then we use about 50 to 60 mils per kilo per day as the upper end of a maintenance fluid rate for cats. So we'll be replacing the deficits, providing ongoing maintenance, and aiming to then taper the fluids as the deficit is replaced, aiming to taper the fluids over the next few days before we go ahead and send the cat home. But once we send the cat home, the owner also needs a way to monitor their cat's hydration status because it's not as easy for owners as it is for us. And one of the ways that I recommend owners evaluate cat's hydration status, in addition to just whether the cat has a normal energy level or is eating well, is by looking at the fecal quality hopefully if the cat uses a litter box, it's easy for the owner to see. So what you can see on the screen are feces from a cat with chronic kidney disease. And this cat is quite dehydrated. So if the fecal matter is very dry and small and hard and crumbles easily, that's a pretty good sign that we have a dehydrated cat. So that's one of the ways that owners can also monitor hydration status and let you know if they see any changes in their cat so that we can go ahead and help with rehydrating the cat. So in the home environment, we also have to have advice for the owner about how they're going to maintain hydration long term. So one way, of course, is by feeding canned foods, either as all of the diet or part of the diet. We have to be careful if we feed only canned or tinned foods that the cat is getting enough calories because there often isn't as many calories in tinned food as there is in dry food. So we do need to monitor calorie intake. But there are other things owners can do as well, like having several water bowls around the home for the cat to drink from rather than just one. Maybe adding some flavor to water with, for example, some low sodium tuna juice, the juice from a can of tuna. And depending on the water source, in some cities, for example, municipal water is treated to make it safe, but that also might give the water a bit of an odor or a bit of a flavor that cats don't like. And so they might drink more water if we either use a filtered water for them, many people do that for themselves anyway, or bottled water. So those are all things that are worth thinking about. The other thing that people sometimes recommend is using pet water fountains, like the one that you can see in this picture. So these are fountains that continually recirculate water, trying to take advantage of the fact that cats often do like moving water or dripping water from a tap to drink. And so it has been suggested that cats actually might drink more water if we provide them with a water fountain and not just a regular water bowl to drink from. Well, there has been a couple of studies done looking at the effect of water source. So trying to determine if cats actually will drink more water from a circulating water fountain versus a regular water bowl. And unfortunately, in both of these studies, the answer was no. The cats didn't drink any more water when the water was provided in a fountain versus provided in a regular water bowl. So it's a little bit disappointing to see that that might actually not make a difference to our patients. But cats often like water fountains anyway, so maybe just from the point of view of increasing their environmental stimulation, maybe it's a good thing anyway. Okay, I'm going to go ahead and send another poll in and before we talk about the next subject. So let me send you a new poll. If I can, just 1 minute. There we go. So here is our second poll. Do you, in your practice, ever teach owners how to give subcutaneous fluids at home? And you might do it for cats with chronic kidney disease, of course, but you might do it for other reasons. So I'm interested to see what your general thoughts are and your experience is on teaching this to owners. So you're all voting very quickly there. Looks like we have most of our votes in. And again, it's almost half and half. So very close to half of you saying yes and half of you saying no. So I did want to talk about that because I think especially for cats with chronic kidney disease, it's really worth thinking about giving subcutaneous fluids. I'm going to see if I can show you a video here of a cat getting subcutaneous fluids. Hopefully this video is going to work for us. So we routinely teach owners to give subcutaneous fluids at home to cats. This is us giving fluids in the clinic while we're distracting the cat with a little bit of food to make it a pleasanter experience. So I do see a comment saying that theoretically owners are not allowed to give injections in Hungary, but I assume that if you have a diabetic cat that you would teach owners to give insulin injections. So I've heard that comment from other countries as well, but it seems to me that it would fall under what would be considered reasonable treatment. So typically we would teach owners to give anywhere between 75 to 100 milliliters of subcutaneous fluids at home, maybe every 1 to 3 days. It depends on the cat's needs. Some cats will benefit from getting subcutaneous fluids maybe every day, a smaller amount every day, and other cats may benefit from getting subcutaneous fluids maybe a little less frequently. So it depends on your patient and what their fluid needs are. And we're going to talk about potassium supplementation in a moment, and we can actually even add potassium chloride to the subcutaneous fluids as a way to give potassium supplementation if we need to. So hypokalemia is actually fairly common and important in cats with chronic kidney disease. Somewhere around 25 or 30% of cats will start to suffer from hypokalemia by the time they're in IRIS stage 2 or stage 3. And that occurs for a lot of reasons. Of course, the polyuria and polydipsia causes loss of potassium in the urine. These cats may not be eating as well, so their intake is reduced. If they're vomiting, they may be losing some potassium in the vomitus. Many cats, as their chronic kidney disease progresses, get activation of that renin-aldosterone-angiotensin system, and that increase in aldosterone levels causes sodium retention but potassium excretion. It increases potassium excretion. And metabolic acidosis will also tend to shift potassium balance in the cat as well. So there's a number of reasons why. And in the picture you can see a cat with fairly severe hypokalemia with that muscle weakness that is causing her neck muscles to be weak, so she can't hold her head up. So of course we call that cervical ventroflexion. And that tends to occur when hypokalemia is quite severe. But not all of our patients, hopefully they'll be diagnosed earlier than that, and the clinical signs of hypokalemia may be more vague. So just generalized weakness, sometimes decrease in appetite. So hypokalemic cats often eat better when they're potassium supplemented. They may just have less energy, or they might develop constipation problems because we do need normal serum potassium levels for normal intestinal function. So as this is a radiograph of a cat with chronic kidney disease that is also suffering from constipation, and sometimes the constipation in those chronic kidney disease cats really just needs to be treated by making sure the cat stays well hydrated and making sure the cat has normal serum potassium levels. So there is not very clear guidance on when we should start supplementing potassium. I think there's probably no question that if the serum potassium is below 3.5 milliequivalents per liter, those cats definitely should be supplemented. soon as they're below 3.9, that's when I start potassium supplementation. And I do it because the majority of a cat's potassium store is actually intracellular. And when we do our blood test, we're only measuring the serum component. So we're actually measuring only about 5% of the cat's actual potassium store. So by the time that minor component, the serum component, decreases, those cats are probably in a whole body deficit, and it takes longer to get them back to normal levels. So I would rather intervene a little bit sooner and get them up above 3.9 so that we can prevent them from becoming hypokalemic and developing a whole body deficit. So we do have a number of options for supplementing potassium. We're going to talk about renal therapy diets in a few minutes. We can use oral supplements. There are a number of them on the market. Of course, it just varies from country to country. Typically, they're potassium gluconate supplements, although in some places you can also get potassium citrate. They might be tablets, they might be powders, they might be gels. So it really just varies depending on where you live. Typically for potassium gluconate, we would supplement starting at about 2 milliequivalents per cat twice a day, and you can increase that up to 4 milliequivalents per cat as needed. So that would be a typical starting point for supplementing potassium. And as I already mentioned, we also can add potassium to either IV fluids. Typically we give around 30 milliequivalents per liter. We don't like to go above about 40 milliequivalents per liter of fluids because at that level the potassium is actually irritating to the veins or irritating to the sub-Q tissue. It starts to sting. So we can put potassium chloride also in the sub-Q fluids as a way of supplementing if the cat is getting supplemental sub-Q fluids at home. Okay, so I'm going to try to do another poll here. Let's see if we can do poll number 3 for us. Here we go. So I'm going to ask you what you think. Cats that have nausea, do they have to have vomiting? So I guess this really is kind of asking you a little bit about what you think the signs of nausea are in cats. So do they have to have vomiting before you feel confident that the cat has nausea? So we'll wait just another moment here. You're all very fast on the voting, which is great. Okay, so we have, I think, most of our votes in, and this is for this poll. It's clearly the majority of you are saying no. That makes me very happy because that's an answer that I think is a reasonable answer. So I'm going to show you a video that really illustrates why we don't want to wait until a patient is actually vomiting to decide that they're nauseous. So this is a video of a cat that actually doesn't have chronic kidney disease. This cat, it actually has liver disease. So hopefully this video will run for us. And what you'll see when we get the video going is, there we go. So you'll see some signs of nausea in this cat without vomiting. So often what we see in cats with nausea is smacking of the lips when they're presented with food, turning the head away from food. They don't want to see it. So the lip licking that you can see that cat doing, sometimes even a little bit of drooling. So I'll see if we can let a little bit more of this video play because it's I realize it's a bit slow, but I'd like you to see that cat's reaction when food is put in front of the cat. So lip licking, smacking, turning the head away, sometimes drooling. drooling. This cat actually was not doing any vomiting. So those are all signs of nausea in cats without vomiting. So I'm glad that most of you recognized, just like us, that it's possible for cats to feel nausea without, without actually vomiting. So let's see if we can get back to our presentation here so we can continue talking about nausea and vomiting in cats. It seems that there's just a little bit of a lag as we get our presentation back. So I do see a question. I'll see if I can answer while I'm waiting for our presentation slides to come back. And the question is, do we use for long-term subcutaneous fluid therapy, do we use those implantable subcutaneous catheters, or do we use a regular needle and an IV drip set? And in our practice, we use a regular needle and an IV drip set. So there are a couple of different types of implantable catheters, or even what are called buttons, that are also implanted in the skin for giving subcutaneous fluids. They have been associated with some significant complications. And so because of that, we have avoided using those in our patients, and we teach owners to do the subcutaneous fluids with a needle and a regular drip set. So I'm not sure why we don't have our presentation starting up again here. I think I'm going to need some help from our technology people to get our slides started again. There, maybe we're going to load now. So when we get our slides back up, they are working on getting our slides going again. We're going to talk about uremia in cats, and why cats with chronic kidney disease suffer from uremia, and then what we're going to be able to do to help them deal with the nausea that's associated with all those uremic toxins. So there are a number of mechanisms why these cats with chronic kidney disease suffer from uremia, or rather, sorry, suffer from nausea. And it's because these uremic toxins affect them both centrally and peripherally. So in the central nervous system, those uremic toxins trigger the vomiting center in the brain, and they also trigger the chemoreceptor trigger zone and cause centrally mediated feelings of nausea. But they also act peripherally, so there are receptors in, for example, the gastrointestinal tract that are affected by uremic toxins, and those peripheral receptors also send signals up to the central nervous system when a patient is uremic, and further trigger the feelings of nausea. So there are a number of mechanisms why these cats tend to feel nauseous. But the good news is we have a number of drugs that we can use to go ahead and treat nausea in these cats. And what I'm going to hope to do as we get our presentation back here, we're going to talk about a couple of these drugs and which are the best ones best ones to use in cats, because there is some new information about the drugs that are available to treat nausea, and that I'll share with you. So hopefully we can use the best therapies that are available. So the one that we'll start talking about when we get our slides back here is meropitant. So of course that's the drug that most of you would know as Cerenia. So let's move ahead here so I can talk to you about meropitant, or sold under the brand name of Cerenia. It's probably the most widely used drug for nausea now. And we do have some data in the literature that tells us we can use this for chronic use. So it has been safe for use over weeks and months in cats with chronic kidney disease to help reduce their nausea and help them to eat better. Typically, the dose would start at a milligram per kilo or as much as 2 milligrams per kilo given once a day. And again, they can get it for as long as they need it. And I think the best advice for using this drug is to start early. So don't wait until the cat is really eating poorly or has a lot of signs of nausea. But as soon as the owner says, they think the cat is a picky eater, not eating well, uh, they have to keep trying new foods to keep the cat eating. So with these early signs of poor appetite, that's when we get the best use of these drugs, when we intervene early rather than waiting until later. There are a couple of other drugs that have traditionally been used for nausea in cats. One that used to be quite expensive but now is much cheaper because there are generic forms of this drug available is ondansetron. And it turns out that we probably have been underdosing ondansetron in cats. So some very recent studies published just earlier this year showed us that really to use this drug effectively, you really have to give it every 6 or 8 hours, not once or twice a day as we used to do in the past, but has to be given every 6 or 8 hours. So while a patient is hospitalized, that could very well be done. But for an owner to do that long term, it's not very practical to ask them to give a drug 3 to 4 times a day every day. So that's why we would prefer to use a drug like meropitant because it's only given once a day. The other drug that gets used in veterinary medicine is metoclopramide. And it turns out that metoclopramide is not as good a drug in cats as it is in dogs. And the reason has to do with receptor differences. So metoclopramide binds to dopamine receptors to exert its effect. And it turns out that cats have more serotonin receptors in the central nervous system rather than dopamine receptors, in contrast to dogs. So this drug works better in dogs than it does in cats. And that's why it's typically not a first choice for me for treating our patients with nausea. Um, the other category of drugs that we've often used in cats with chronic kidney disease are the acid blocking drugs. So drugs like the H2 receptors like famotidine. And the rationale for using these drugs was to treat uremic gastritis. So in dogs and in people, we know they get uremic gastritis when they get chronic kidney disease. And that can affect appetite. So it has been always assumed that cats must get uremic gastritis as well. And so that's why traditionally we've often recommended things like famotidine or ranitidine for cats with chronic kidney disease. Well, it turns out that cats are not like people and dogs, and some research that's been published just in the last couple of years actually looked at whether cats with chronic kidney disease have uremic gastritis. So this first paper that I'll show you looked at 37 cats with chronic kidney disease compared to 12 non-azotemic cats. These were cats that all eventually died and went to necropsy, so they were able to look at the stomachs in these cats. And what they found, or rather what they didn't find in the chronic kidney disease cats, were any of the hallmarks of uremic gastritis. So in people and in dogs, they get gastric ulceration and gastric edema, but these cats had no evidence of ulceration or edema. Rather, what they did have was some gastric mineralization and some gastric fibrosis. So it may be that cats just have a different response. So their gastrin levels go up, but they don't seem to have the same response to that as people and in dogs. And I just saw another paper that has been published within the last month that looked at the gastric pH of cats with chronic kidney disease to see if indeed they did get increased acidity as we used to think. And it turns out again that they don't. So while people and dogs might get increased stomach acidity with chronic kidney disease, it turns out that cats don't. So this is a class of drugs that we now no longer recommend that you would prioritize for use. in cats because we don't have evidence that cats actually need to take these gastric acid blocking types of drugs. And there's certainly enough other therapies to give to cats that we would rather prioritize therapies that have better scientific evidence behind them. So the other drug that we can use is mirtazapine, and mirtazapine is a nice drug because it has both antiemetic and appetite stimulating properties. So for some patients, this one drug will achieve both of those effects for us. In other patients, we might have to combine meropitant and mirtazapine together. So in a cat with chronic kidney disease, we would typically give a dose of about 1.88 milligrams per cat. That comes from taking a 15 milligram tablet and breaking it down. And in a chronic kidney disease patient, we would give the mirtazapine every 2 days. And we do have some evidence that that does increase food intake, it does increase activity levels, and it does decrease vomiting. So meropitant and mirtazapine are two excellent drugs that we can use in our patients with chronic kidney disease. So we're going to talk a little bit about renal therapy diets coming up, and some of the ins and outs of using renal therapy diets. But before we do that, excellent. This is the poll that I would like us to do. So again, there's no right or wrong answer, just yes or no. Do you commonly recommend renal therapy diets in your feline patients with chronic kidney disease? I'm just interested to see how you feel about using these diets in your patients, and if this is something that you do tend to recommend. Wow, we really quickly got pretty much all of you saying yes, I do use renal therapy diets for my patients. Okay, so we'll talk a little bit about that because we do want to set our patients up for success when we're using renal therapy diets. So we also always want to make sure that our patient is ready for a renal therapy diet. And so what I mean by that is there's I guess a right time and a wrong time to consider renal therapy diets. So we never want to, we'll talk about some of those things in a minute, but we want to actually evaluate our patient and say, is this the right time to start you on a renal therapy diet? So we'll talk a bit more about that in a minute. But the reason that we recommend these renal therapy diets, and of course we've got quite a few of them on the market now, is that there are a number of published studies. These studies have been published over a period of several years, giving us good support that renal therapy diets actually do help improve survival times and help slow disease progression in our patients. So there is good scientific evidence for the use of renal therapy diets in our patients. And these diets are more than just diets about a protein content. So we tend to often will say we're going to use a low protein diet. Well, actually, we're doing these diets a disservice if we just talk about them in terms of protein content because they actually do a number of things. They restrict sodium, they restrict phosphorus, and I have that highlighted in yellow because I actually think that's the most important thing that these diets do for our patients. The number one benefit is restricted phosphorus. They counteract metabolic acidosis. They're often higher in calories, so they help patients maintain weight. And they're supplemented with things that they need, like potassium and B vitamins and omega-3 fatty acids. So they bring a lot of different benefits to the table. But there are situations where cats will have a very difficult time changing to any new diet, let alone a diet for kidney disease. So we would never try to change a cat's diet if the cat is feeling painful or nauseous, or when they're actually in the hospital, or when their appetite is really poor. So we would want to make the conditions the best possible. When the cat's at home, it's in stable condition, it's not nauseous or retreating the nausea. Maybe they're eating their current diet pretty well, and then we'll try to change them slowly to a renal therapy diet. So I think sometimes we have problems changing cats to new diets because we're trying to do it under bad circumstances. So I did mention serum phosphorus. I think this is really important for us to remind ourselves of why phosphorus restriction is so important in our chronic kidney disease patients. So it does either prevent or reverse secondary hyperparathyroidism that we can see. It decreases the severity of the renal lesions. It maintains glomerular filtration rate. And there does seem to be some evidence that cats with controlled phosphorus levels will live a longer life than cats that have higher serum phosphorus levels. So the iris system does give us some phosphorus restriction targets, and these targets vary a little bit by stage of disease. But what I want to point out to you is these are all targets within your lab's normal reference range. So we're not talking about waiting until serum phosphorus rises above reference range. We're talking about keeping serum phosphorus at the low end of a normal reference range. So it's important to understand that distinction. We want to keep it well within the low end of your lab's reference range. And by doing that, by keeping serum phosphorus to the low end of the reference range, that's when we get all of those benefits that we just talked about. So how do we control serum phosphorus? Well, we've already talked about one way, and that's a renal therapy diet. Because of its restricted phosphorus intake, many cats will be controlled with just a renal therapy diet. But we may also need to use phosphate binders. And we can do this if a renal therapy diet by itself isn't enough, or maybe the cat needs to eat a completely different kind of diet for some other reason. We can't use a renal therapy diet, then we would use a phosphate binder. So these are products that literally bind the phosphate content in the food. So they work by binding the food in the gut. And because they have to bind with the food, they need to be given within 2 hours of a meal in order to bind the phosphorus and prevent it from being absorbed with the other nutrients in the food. And there are a lot of different phosphate binders that you can use. Again, it just varies from country to country, what's on the market. All of these work. So generally, in most countries, we use what's available and what is most palatable to get into cats. The only comment I would make is that if you're using a calcium carbonate based phosphate binder, that you should monitor serum calcium. So it's not common that we see increased serum calcium, but it is possible, and we wouldn't want that to happen. So you do need to monitor serum calcium in cats that are on a calcium carbonate type of binder. And so this goes back to the survey that I showed you at the start of our presentation on talking to owners whose cats have chronic kidney disease. So in those owners, that was over 850 owners, at least half of the cats needed both a phosphate binder and a renal diet eventually to control their serum phosphorus. And most owners used a product that they could mix with food, and the majority of cats accepted that phosphate binder mixed into their food within a period of a few weeks. So it might not happen, acceptance might not happen immediately, but if the owner is slow and patient, the majority of those cats accepted the phosphate binder in their food within the 4 weeks. So that's good news. So we're going to talk about hypertension and then proteinuria. And let me see if we can do one last poll, if we can get the last poll sent in here. I've been having trouble getting these polls to open, but let's, oh, there we go. Thank you very much. Okay, so here is our last poll. So I'm going to ask you, again, of course, there's no right or wrong answers to these. I just like to know how many of you have the equipment to measure blood pressure in your patients within your practice. There's lots of different systems available for measuring blood pressure in our practices, and we'll talk a little bit about the type of systems that are useful. So I just like to get an idea of how many of you already have equipment. Some of you that don't might be thinking of getting equipment, but I'd like to see how many of you do. So looks like we're running at about 1/3 of you are able to measure blood pressure in your practice, and about 2/3 of you currently are not. Okay, so let's see if we can go back to our presentation here, and we'll talk a little bit about high blood pressure and why we care about it so much in our patients with chronic kidney disease. So if you remember, that is one of the other ways that we get iris staging done. The second tier staging is by looking at systolic blood pressure. It's really only systolic that we look at in cats. It's the one that matters. And so cats get put into one of 4 categories. Either they're normal, they're borderline, or they're moderate to high hypertension. And the reason we care about it is because over time, chronic high blood pressure does cause organ damage. So in human medicine and in veterinary medicine, it's called the silent killer. So the four target organ systems that are affected by high blood pressure are the eyes, the central nervous system, the kidney, and to a lesser extent the heart. We usually don't see clinical cardiac disease, even though there are effects on cardiac muscle. So more importantly, what we're worried about is problems within the eyes. So we can see retinal bleeding, we can see hemorrhage in the anterior chamber, we can get retinal detachment, and of course loss of vision. We can get neurologic signs such as ataxia, circling, head tilt, maybe even seizures. And the high blood pressure causes progression of kidney disease. So there's lots of reasons why we want to control high blood pressure in our patients. In particular, in the context of the kidney, hypertension over time increases azotemia. It is closely related to proteinuria. So many cats with hypertension develop proteinuria. That's important because proteinuria is a negative prognostic indicator. So if you have proteinuria, you don't live as long as cats without proteinuria. And it does contribute to progression of chronic kidney disease. Now, there is a really great new set of guidelines available from the same journal website that I showed you earlier on. So this set of guidelines just came out in March of this year from the International Society of Feline Medicine on the diagnosis and management of hypertension in cats. Again, it's a free download. So I would recommend that you take a moment to also go and download this set of guidelines afterwards to give you some really practical advice on measuring blood pressure in cats. And I'd also recommend that you look at this web page that has some free resources from the International Society of Feline Medicine. So they have recommendations, they have a blood pressure assessment form if you need one for your practice, and they also have some great videos on how to do blood pressure assessment to help teach you if you're just getting equipment or to help you if you're struggling a bit with measuring blood pressure in your hospital. And it also talks about what's the best type of equipment to buy, because there are a number of types of equipment on the market, and only certain ones like the Doppler systems or the high definition oscillometric systems would be recommended for cats. So those are some great resources for you. We also should be doing retinal exams on our patients, really on any exam of a cat, but certainly on older cats. And it can be done very simply, as in this picture, with a hand lens. So typically we would use something like a 20 diopter hand lens and just a pen light for a light source in a darkened room to get a look at the retina of a cat. We may see signs of high blood pressure, so we may see evidence of retinal detachment or edema or changes in the retinal vessels that would go along with high blood pressure. So even if you can't measure blood pressure with equipment in your practice, you can look at the retinas. And if you see changes in the retinas that suggest high blood pressure, that might be enough for you to go ahead and treat your patient. So what do we do for treatment? Well, the drug of choice is amlodipine. It is the first choice from most experts. Typically, we start cats at 0.625 milligrams once a day. We can go up to a maximum of 1.25 milligrams, that's per cat, twice a day. And typically, I would reassess a patient within a few days of starting the drug because it does tend to work fairly quickly. The other drug would be an ACE inhibitor like benazepril. Not always our first choice drug because it doesn't tend to be as effective at lowering blood pressure, but it can be combined with amlodipine. If amlodipine isn't enough, there are a small number of patients that need more than one drug, so we would combine these two drugs together. And benazepril is also useful in treatment of proteinuria as well, so we might select it for a cat that has, it would be an option for a cat with high blood pressure and proteinuria. So these are images of a cat with a high blood pressure, a systolic blood pressure of 200 before treatment with amlodipine. And what you can see, let's see if I can show you here, in these pre-treatment images, the green arrow is pointing to those fine blood vessels and how they become a little bit twisted or a little bit tortuous. You can see it especially over here on this side. And we also can see a little bit of retinal edema in this image as well. Now, here's the same patient 6 weeks later after being treated with amlodipine. And I hope you can see the difference, especially, let's see if we look at these blood vessels here now. See how much smoother and straighter they are because the drug has reduced the hypertension, and a lot of the abnormalities in that retina have disappeared. So we actually can reduce retinal changes and preserve vision as long as the problem is diagnosed early enough. So I would typically reevaluate patients like the one in this picture who has some bleeding in the anterior chamber. I would reevaluate that patient probably within 24 to 48 hours. But if there's less urgent changes, no hemorrhage, no vision loss, I typically would reevaluate the blood pressure again in about a week. And then ongoing, we would usually recommend that we look at blood pressure assessment in these cats. Maybe every 1 to 4 months. It depends on the cat and what else you're monitoring and how high the blood pressure was and so on. But they would need some amount of ongoing monitoring. Okay, so now we're going to talk about proteinuria in these patients with chronic kidney disease. It's one of the really important treatment targets because this is one of the ones that actually does prolong survival, potentially in our patients, and has an effect on disease progression. So we care because it turns out that protein itself plus other substances that get excreted into urine in chronic kidney disease actually drive inflammation within the kidney, and over time that leads to fibrosis. So it's really important that we look for proteinuria in these patients. We do know that patients that have proteinuria, as I mentioned before, don't live as long as patients without proteinuria. So it is important to monitor. In dogs and in people, we have some studies that show if you do have proteinuria and we're able to treat it, it improves your survival time. So we haven't seen those studies done yet in cats, but we would, at least for the time being, presume that cats would get a similar benefit if they are diagnosed with proteinuria, that treatment would be of benefit to them. And I just want to remind you that there's 3 sources or 3 ways that we can get proteinuria in cats. The first one is not very common, so pre-renal proteinuria caused by diseases that increase plasma protein. There's not very many diseases in cats that do that. Multiple myeloma would be an example. What we're looking for is renal proteinuria. So it can be mild or transient, which is why we usually would want to see proteinuria present on more than one occasion to be sure it's persistent. And it is associated more with glomerular damage, so that's what we're looking for. And then there are cats that have post-renal protein, and that's protein that comes from the lower urinary tract, either because they've got urinary stones or they have a urinary tract infection. So what we're looking for in this context is only the renal proteinuria. So how do we measure that? Well, we use the urine protein to creatinine ratio. We get a cystocentesis sample, so we avoid getting protein that might come from the lower urinary tract. We do a urinalysis and examine a urine sediment first to make sure there's no inflammation, there's no evidence of infection, and there isn't any obvious hematuria, because we don't want to detect protein from those sources. And as long as the urine sediment is quiet, then we can run the urine protein to creatinine ratio. And again, we'd like to see the protein present on more than one occasion so we know it's persistent and we know the patient should indeed go on treatment. And these are the staging by proteinuria. These are the levels that are recommended by the IRIS system. So levels, urine protein creatinine ratios below 0.2 are considered normal in both dog and cat. The borderline group for cat is 0.2 to 0.4. It's 0.2 to 0.5 in the dog, and for the dog over 0.5 is overtly proteinuric, and in the cat it's over 0.4. So I typically would recommend that you treat any cat that's in the borderline or the overtly proteinuric group because we do see changes in survival times even with cats that have proteinuria in that borderline group. So we would want to start treatment as soon as a cat is persistently over urine protein creatinine ratio of 0.2. And of course, we've already mentioned benazepril, sold under various brands, an ACE inhibitor that has long been a treatment for proteinuria, and one of the newer drugs we have on the market for treating proteinuria in cats is telmisartan, an angiotensin receptor blocker, and sold in many countries under the brand name of Symmetra. So we do have some very nice choices that are effective for treating proteinuria in cats. And that would go along as well with a renal therapy diet whenever possible because of the controlled protein in those diets as well. So we're just going to finish up because I know we're getting a little bit over time here. We got a little bit slowed down with our technology, but I'll just finish up talking a little bit about ongoing monitoring for these patients. So every patient's disease is different, so we do need to individualize our treatment plan and our monitoring to make sure that the cat can tolerate it, that the owner can carry it out. This is a progressive and dynamic disease, and we will be seeing these patients over a long period of time. So we have to make sure that we prioritize the most effective, most evidence-based treatments, and that we try not to overwhelm either the cat or the owner with treatment because it's a long-term disease. Typically, cats that are diagnosed early, as we now can, these stage 1 cats, you might only see them every year as you would normally see a senior cat anyway. It might not really change things, but you might do some closer evaluation of their serum chemistries and their urine-specific gravity, for example. Once they're in stage 2, we would like to see them, I think, at a minimum of twice a year. Depending on what their problems are, you might see them more than twice a year. And then, of course, as disease progresses, we would want to see them more frequently. So the stage 3 and the stage 4 cats tend to have more problems. They tend to be on more drugs, more therapies. They might even have other diseases going on. And so that's going to dictate how often you would recommend the frequency of monitoring for those patients. And when we do get those patients in for monitoring, we do want to look at their weight, their body condition score, their muscle condition score, get some information from the owner about how well they're eating, what's happening with water intake and urine output. Is the owner having any problems giving the medications? Is there anything that they're concerned about? And we would do some periodic laboratory monitoring, serum chemistries and CBC, that full urinalysis with the urine sediment exam, the urine protein creatinine ratio, blood pressure assessment, and even again, if you don't have blood pressure equipment, you would want to look at the retinas in these cats. And at least once a year, I would do a urine culture because somewhere between 10 and 15% of these cats with chronic kidney disease will get a urinary tract infection, and it's often clinically silent. So we won't be able to detect it unless we go ahead and perform a urine culture on these cats. So they do need a fair bit of monitoring. And having said all that, this is a quote that I really like to end this presentation with. It's from Dr. William Osler, who is often considered one of the fathers of modern human medicine. And he said, "The good physician treats the disease. The great physician treats the patient who has the disease." And I think in veterinary medicine, we can add to that we treat the patient and the owner of the patient who has the disease. So we always want to make sure that we maintain that human-animal bond, that we answer owner concerns, that we make sure that they are able to deal with the treatment and the monitoring plan that we've outlined, and we might have to adapt it to meet the needs of the owner and the patient. So I thank you again for your patience in working with us this evening and going through this presentation on chronic kidney disease. And of course, again, I thank our sponsor, MSD, for supporting this webinar. And again, my contact information, so if I can help you or follow up with you on any of the things we talked about, then please feel free to go ahead and get